Hello, everyone, and welcome back to another episode of Under Your Skin with Dr. T. That's me. Today, we have a really special guest. And today, this is not going to be predominantly centered about your skin. Today, we're going to be talking about fertility for both women and men, more so for women today. I have with me Dr. Prateek Makwana, IVF specialist and embryologist, somebody who literally says that he makes babies in labs. Welcome, Prateek. So
Thank you.
nice to have you.
Thank you so much.
So, Pratik, let's dive in. The first question I'd like to ask you is that so many women are now peaking in their careers in their 30s, and your careers are literally taking off, and everyone's
Yeah.
talking about the biological clock. So, I want to ask you, how real is this biological clock? Should we really be worrying about it? How much should we be worrying about it?
So, when women are born, right? Specifically women in this case, there are a limited number of eggs. And as they age, it arrests until they hit an age where, the egg stimulation can begin again. And then that's when periods happen, right? So that's the start of periods. And then you have a limited number of eggs. Now, every cycle, some eggs will get stimulated, and the best egg out of that will be released. So that's your period, right? Your number will go down every single time. Now, as the age increases, those number of eggs are going down. And the body has this tendency, the best egg should always be the first one to be released. So by the time, let's say you hit 35, your body has used most of its good eggs. And now it's the second tier eggs which will come into play, and then third tier as age increases. So biological clock plays a very important role. Age, we do consider age a huge criteria for a successful pregnancy, and not just pregnancies, for even congenital anomalies. The risk of having diseases when babies are born. So that does play a role. But with IVF, with ART, I think a lot of people have found ways to circumvent the biological clock and to actually delay their pregnancies up to a point where they are actually comfortable having that baby. So I think, yeah, as the technology increases, we might have better options to, beat the clock.
Yeah,
But
that's
at
true.
this point, it's important.
That's true.
Yeah.
And we can't completely deny that we need to think about it if we want to have babies. I know this if is a very big question because
Yeah.
so many people now are
Yeah.
choosing not to have babies.
Yeah.
But if we do want to have babies, at least back of our minds, we can sort of, think about it and live our lives in a way that this option is preserved in the future.
Yeah. Yeah.
So coming to general stuff to preserve your fertility. I'm
Yeah.
say 30 and I want to plan a pregnancy at some time in the future. I don't want to plan it right now.
Yeah.
What are the general tips that you would give people who want to plan a pregnancy in the
So
future?
some of the most cliched advices that we have heard from our parents, our grandparents, and even they have heard from generations before, they usually work. So just yeah, it's not that difficult, and people have complicated
How
this a lot.
disappointing.
Yeah, you will have great ways of improving your lifestyle, and it'll help you save your sperm, save your eggs. Just do the most basic things: eat well, sleep well, don't smoke or drink, or if you're doing it, might as well just like keep it limited, right? That helps. We always have the option of freezing the sperms, freezing the eggs. But other than that, if you don't want to go through that and you still want to improve the chances of getting staying fertile at the age of 35 or above, or even in your early 30s, the best way to is just take care of your health and get some regular tests done, which people usually avoid. They'll only come to an hospital when there's something wrong with them.
Yeah. So coming to that, what are the tests you can do to assess your fertility?
Okay, so for women, we have an ultrasound which essentially looks at the follicular count. We call it antral follicular count. So there's AMH, which is for testing for the anti-Mullerian hormone, and then we have FSH levels. So these are the three things that we'll check. We'll also check for hormones, and we'll also check the regular blood reports, vitamin D, B12, everything, so that we have a great idea that okay, this is the complete picture.
Right.
For men, we ask them to ejaculate in a cup and they can give the semen sample, which is sort of an insight into what the fertility status is, along with the usual blood tests that we all do and testosterone levels, of course.
Okay. Bringing me to the next question, is male fertility an issue? Does it decline with age or more with lifestyle?
So, for the past 30 years, what we are seeing is that there has been a constant decline in male fertility. And I'm I'm shocked to say this, but I've also seen doctors come to my IVF unit and be like, okay, sir, wife ka IVF karwana hai. But that's not how it works, right? You have to test for both the partners. But
That's
yeah,
so important. There's always
yeah.
so much blame and shame on women.
Oh yeah,
And
absolutely.
it may very well be a male issue, and that's also not a problem. Like, neither of it is a problem.
Neither of it is because anybody can be infertile, right?
Yeah.
It's a disease.
There's
I
nothing
mean,
wrong with you if you're
yeah,
infertile.
yeah. But that's all the mentality. The mentality in the country is of a very patriarchal mindset, and I think men have also suffered because of it because they cannot come out openly if they want to seek treatment, and
Correct.
women, of course, suffer because of it, right? So that is the little situation that we have, and for men, I do recommend that they also get tested whenever they get time, so that they can be on top of their fertility. It's not too expensive, also, and it's pretty easy to ejaculate in a cup.
But but for a man, does their fertility, like, say, is there a biological clock for men?
Yes. For the longest time, it was thought that men can have babies as long as possible. The sperm survive and everything, which they do. But now we are seeing that actually, as age increases, the DNA integrity of the sperm it just dips. So there are higher chances of miscarriages, higher chances of babies born with congenital anomalies or risk factors increase, especially if both the partners of a higher age group. So yes, the age definitely affects the sperm. Maybe not as much as it affects the eggs,
Yeah.
but it most likely does.
Okay. And what about egg freezing? So a lot of my friends
Yeah.
today who want to defer their pregnancies for a little longer keep asking about egg freezing. So is this a viable option? How does it
Oh
work?
yeah. So most people think of it as insurance, which to a point is a good guess, but egg freezing has picked up in the last few years, especially social egg freezing. Like there are people who go for cancer treatments. Of course, they have to freeze their eggs before because once the cancer oncogenic treatments start, it's very difficult to regain
Yeah,
your
of course.
fertility, right? So they definitely freeze. But now people who just want to delay their pregnancies, those who are married, those who are in a relationship, even people who are not sure about their partners,
Correct.
will actually freeze the eggs and not embryos, which is when egg and sperm are inseminated. So egg freezing is a very good option, and I have recommended to a lot of my friends who want to delay their pregnancies or who are single, who don't have a partner, and
Yeah.
they probably want to think about it, let's say 5 years in the future, and they're 34, 35 right now. Uh, Even for younger people who come to me and they're like, we want to freeze our eggs at, say, the age of 32, I recommend that if you're going to freeze at 32, might as well freeze it at 28 or 29.
Yeah, that was my
Yeah.
next question. How soon, what's the most ideal window to
Okay.
freeze your eggs?
So you can ideally freeze at any age you can. If even if you're 38 and you feel okay, I now want to freeze my eggs, you can. The reproductive age group per theory that we say is anywhere between 27 to 32 is
Okay.
the age group. But if you're past that or if you're not coming to that and if you still want to freeze it for whatever reason, you can go and freeze your
But the
eggs.
sooner you freeze it, the better it is
Yeah,
in
yeah.
terms of egg quality.
In terms of egg quality, but I think with the drugs that we have now, with how we stimulate the patient now, we can get a good number of eggs
Okay.
and we can freeze them, and then when it's time, we can take them out.
Okay.
Yeah.
Is it a very painful process? How hard is it?
Not at all. The only part that I think is taxing is the hormonal injections. They're subcutaneous,
Yeah.
but it's the dosage of hormones which will bring about mood changes, changes in the skin. You must have
Skin, we
seen
see a lot of
patients.
those. We see a lot of
Yeah.
those.
So that happens. That is a little burden, and it's about 12 to 14 days of it.
Okay.
But then
That's
we
that's
also,
not too long. That's
yeah, it's not
doable.
too long.
Yeah.
And now the practice in IVF has also moved to a place where we try to use as less dose as possible
Right.
to get as many eggs as possible. So that has been the practice for the past 5 6 years, and I think the world has globally like sort of started moving towards that
Okay.
to give as low dose of hormones.
And is it a guarantee? Like, if I've frozen my eggs, is it a guarantee 10 years later they're going to be good enough and I will for sure 110% conceive?
So not really. Uh, Eggs, when they are frozen, we call eggs the most unforgiving cell in the body because they have what we call a meiotic spindle in the cells. So when you freeze them, the spindle will break down. And when you take them out again, if the spindle doesn't form again, the eggs is lost. So we get about 70% recovery in eggs.
Okay.
And for people who freeze, who inseminate and then freeze the embryos, we get almost 100% recovery in that.
Oh, really? Wow.
Yeah. So egg freezing is still picking up. It's still improving. 70% is great, to be honest. Like if you have 12 eggs, you might get all 12, or you might get up to 8 or 9, which is amazing.
Which is great. Yeah.
Yeah. So that exists. It's not a guarantee for sure, because IVF in general is not a guarantee. About 40-50% is the global success rate. If anyone says 90-80%,
Implantation is one more headache.
yeah, that's that's I think that is something that people have to be aware about. Usually people have this thought कि, okay, IVF है तो 100%.
Yeah.
But for people who want to think कि कितने साल we can freeze the eggs, after 5 years, 10 years, will it be viable? And a very interesting fact is that the longest recorded egg freezing procedures that have happened, there's one 27 years of freezing of eggs, there's one 30 years, and in fact this was a donor egg transfer. So the person it was transferred to was born after the eggs were frozen.
Oh my
of
God.
the donor.
That's so cool.
Yeah, so that happens. It's Captain America in real life.
Very interesting branch you have. My next question is, what about sperm freezing? Is sperm freezing a thing? Is it done? Does it work?
Yeah, in fact, sperm freezing is done more routinely. Like for us, I'm sure a lot of IVF centers do that. Anytime a patient is going through an infertility treatment, we will freeze the semen as backup anyway. So
That was what Wiki Donor was all about.
So Wiki
essentially.
donor comes from ART banks. That's different from a IVF center.
Yeah.
If you want donor samples, you will contact a bank.
Correct.
And the donors won't be getting any TVs or anything. उनको orange का juice पिला के भेज देते हैं.
So essentially in an IVF center, it's your own sperm to be used for yourself.
And
in
if
the
they
future.
want donors, then we will have to file the necessary documents and then get donors from the ART banks.
Okay, lovely.
So
Again, my next question is PCOS. So many young girls have PCOS, and does that mean that they would have difficulty conceiving in the future?
yes, I mean PCOS, we look at the rates, right? As a dermat, even you come across a lot of people because they have a lot of skin issues as well. So almost one in 8 people in reproductive age group have PCOS or go through PCOS or suffering from it, and they don't know until the symptoms come out. Why people consider it a threat to fertility is because they don't know how to manage it. Most of the times, losing just 10% of the body weight will improve the menstrual cycle
Massively.
massively.
Yeah, we see it all the time.
Exactly. And I think that's something that people don't know. For them, it's like, okay, हमको बहुत ज़्यादा weight lose करना पड़ेगा to come back. And that sort of demotivates them.
Yeah.
But yeah, losing just 10% of your total weight works. And in fact, most of the times, people with PCOS can get pregnant without seeking any fertility treatments.
Yeah.
But it's better to just get yourself evaluated. So in case you need any treatments, you can hop on it early rather than much later.
Correct. I feel once you hit 30, maybe it's just best to know what your options
best
are.
to
Then you
know.
can figure what you want to do later.
You don't have to go and do it,
Yeah.
but just being aware just helps.
Yeah.
And now there are a lot of ways to manage PCOS, with lifestyle. You have drugs as well, which can help you. And then, of course, you can leave them and go back to your lifestyle once you have hit the threshold.
Yeah.
So, yeah.
Lovely. Okay, now say someone has a fertility issue, a borderline fertility issue, or a major fertility issue. Is IVF the only treatment, or are there other options as well?
So, IVF is the last resort. Unless there is something which requires the use of IVF, let's say blocked fallopian tubes, where the egg can't travel anyway, so you can't try any other treatments, right? You have to go for IVF. But for everything else, IVF is the last resort. First, we start with just timed intercourse and then stimulated timed intercourse. So we'll give drugs, stimulate the ovulation, and then ask them to sort of have intercourse at a certain point, a certain time in the day or on certain day. Then this IUI, which is intrauterine insemination. So what we'll do is when people have intercourse, the sperms travel through vagina, cervix, and then the uterus. In this case, we'll take the sperms and we'll just directly inseminate in the uterus, completely bypassing vagina and cervix and the environment, the hostile environment that they have for the sperms, because only a few sperms reach. So that also can increase the chances of pregnancy. And after a couple of cycles of IUI, 3 is usually the sweet spot of number of cycles. Then we go for, say, IVF. So there are options available and they are much cheaper compared to an IVF cycle.
Yeah. So not everyone who's infertile needs IVF.
Needs to go through IVF. something else might work. In fact, we had a patient who had come to us from a different IVF center, and they had already done 3 cycles of IVF.
Okay.
So, and the gap wasn't too much. So we asked them to wait a bit, and we asked them to wait for a few months, and maybe like just go take a vacation or something to relax before we can start the treatment again. They got pregnant on that vacation. So
I think a vacation is the best fertility
Yeah.
treatment.
like, yeah, I mean, you didn't even need IVF.
If a couple says starts trying to conceive naturally, how long should they wait before thinking about the possibility that there's something wrong and they need to seek help and treatment?
So what we recommend is, what the guidelines ask us is, that if you have been trying for an year of unprotected intercourse, you're trying to conceive, if you haven't been successful in the span of 1 year, then you come seek fertility consultation. Doesn't mean you have to go through the treatment. You just seek consultation.
Right.
And if you're above the age of 32, then you wait 6 months.
Okay.
Yeah. So that you don't waste a lot of time again.
Yeah, I think most of us are above the age of 32 when most people nowadays start.
Yeah, I mean, in our age group,
Planning.
definitely.
Yeah.
And I see a lot of them not wanting to have kids
Yeah.
or stopping at 1 kid.
Yeah.
So for them, I do recommend that if you have been trying, then if 6 months have passed, then you can come. The age is 35 by
Yeah.
definition, but I think they should start a little early. They
Yeah.
can get a consultation at 32 as well.
Yeah. Just or on the safe side.
Yeah.
You know, I've seen a lot of my patients or even some of my very close friends who've gone through this entire journey of, you know, infertility. They've started trying naturally, nahi hua, IUI kiya, IVF kiya, and, you know, sometimes a few cycles may fail. And it can be very emotionally draining and very emotionally taxing. What's your take on that? You must have seen a lot of patients like this, right?
Yeah. In fact, just for that, because it's a very important part in the treatment, there are hormones involved. And the burden of it still lies on the women because they are the ones taking the hormone. All the male partner has to do is ejaculate, right? That's literally everything that he has to do. Or sometimes even surgical sperms are required, but that's okay. That's very rare, right? In this case, I think it's important that you just support your partner. You don't have to go out of your way to do anything. Just being there and supporting your partner, I think, works. A lot of people lack that as well. In fact, we have psychologists in our center so that they can counsel patients on how to deal with the stress, with the changes, and they can counsel their male partners as well. Because a lot of them, they also aren't aware. They don't know what to do.
Yeah.
And we can't really blame them because that's sort of the society we grow up in, right? So that really helps, supporting your partner throughout the treatment, because it will get taxing. It will have some mood changes. There will be some erratic behavior. They might get depressed due to all the skin changes, the weight gain that they're seeing.
Yes, that's huge. And also, I feel there's a lot of toxic communication that starts happening. There's a big blame game that
Yeah.
starts happening. And I think that really needs to end. And you have to realize that you're a team and this is the only way this is
Yeah.
going to work.
No, I completely agree with you, because even in the families, not just the partners, it's because I'm from Rajasthan and we usually see it happen a lot in the families that they start blaming the wife that
Yeah.
"Okay, you are not able to carry.
Banj and all those words.
Those are
Terrible.
such derogatory terms. But then that's sort of what has been happening, and unfortunately, that is the reality. And when they find out, only to find out sometimes that it's the men who have no sperms in the semen, right? But all the blame goes to the women because they carry the child, so they must be responsible for everything, right? So yeah, I think in that case you have to be a team. You cannot put the blame on the other person, because that the stress actually does affect the chances of the fertility treatment.
And I also feel, keeping these other voices quiet, like this is a very personal journey for a couple. No one has the right to talk about or to ask questions about what's happening, how's your progress. No one needs to know.
Yeah.
The grandparents don't need to know. Nobody needs to know. Uncles, aunties, neighbors. I don't know why everyone is so obsessed with why are you still not pregnant. That's quite crazy in our society.
In fact, we do see a lot of times it's the in-laws also come to the fertility counseling, and then we have to ask them to just wait outside.
Yeah, you
because
can't discuss your sex lives in
Yeah.
front of your in-laws.
we can't ask
a
them
lot.
certain questions.
Of course.
So we always ask them to wait, but they're like, no, we want. In fact, we have seen this a lot of times that the mother-in-law and the wife come for the fertility counseling. Like, where's the husband?
Yeah.
We want his tests also.
Yeah, we need some sperm. What is the mother-in-law going to do here? Oh, quite terrible. What is the craziest story you've heard?
There are a lot of crazy stories. One story that I've actually spoken about publicly also is that I think about 6-7 years back, and a patient had come to us. It was their second marriage, and the when we did the test, we saw that the guy had azoospermia. And so in the history taking, I was just asking him, like, second marriage है, first में क्या हुआ? The first में भी बच्चा नहीं हो पा रहा था, so we took a divorce. I was like, आपने तब टेस्ट कराए थे? Because clearly, like, it's azoospermia. Like, you don't have sperms in your semen.
Yeah.
He's like, नहीं, IVF से सस्ती शादी थी. So we got married again.
That's insane. There's so much that needs to change in our society that, like, I think these stories could just go on and on. You know, both my parents were gynacs.
Yeah.
As I was telling you earlier, they used to practice IVF. And the kind of stories I would hear from them were also insane. The number of people asking for sex determination or asking them to choose male sperms, which is just like, it's insane. The kind of things that the stories I've heard of.
Fortunately, that still happens.
Still does. So many years later.
Yeah.
Crazy. One more thing that I wanted to ask, which is something that I feel very strongly about. What do you think about adoption? So many people trying so hard, and it's not a 100% guarantee that you would conceive for sure. What do you feel, particularly being an infertility specialist? What do you feel about adoption?
In fact, I think it's a great idea. I also recommend adoption to a lot of patients who have already gone through cycles and then they are traveling all the way to Jodhpur. They're like, no, we want to get IVF. But why you want to get IVF? There are other options available, and if you and your partner are comfortable adopting, might as well do that. I mean, if you have certain issues where you also want to go through donor sperms and donor eggs, you have the option of adoption available to you.
Yeah.
But yeah, I do believe it to each their own. Even though it's a great option, and we do put it in our counseling. I think a lot of IVF centers should be doing this. Even if they don't, if they are, then it's great. If they don't, they can. You offer adoption as well, and it is a lengthy process in India. It is a little hectic, the whole process, but then so is IVF, right?
Yeah, of course. And I really feel that there's so many children out there, abandoned kids or orphaned kids, waiting to have love. You're waiting to give your love.
Yeah.
If you're not able to conceive, or honestly, sometimes I even feel even if you are able to conceive and you can adopt a child, it would be such a genuinely
It would be amazing.
godly gesture that you could possibly do.
But I think the one thing that I've noticed with specifically people going through 6-7 cycles of IVF is either them or someone in their family who has this mindset of nahi hamara khud ka bachcha hona chahiye.
Yeah, this obsession with khud ka bachcha is crazy.
That is, I mean, after a certain point, it becomes too much for the actual patients to handle, right? For the treatment that they're going through. So there is an option. Maybe sometimes they don't get to explore it, or they are demotivated against it. But it exists, and for anyone who's trying to, I think they can definitely look into it.
I, as a dermat, have seen a lot of patients coming in on fertility treatments who end up with a lot of acne, a lot of hormonal issues affecting their skin and hair.
Yeah.
So what do you have to say about that?
So I think that is bound to happen. Any drug that we take will have side effects, right? And this is subcutaneous hormone injections. We give FSH, LH to begin with, and then we get GnRH antagonists, right? So they will have the effects as they would. And earlier, I don't know how often or how intense of the cases you see right now, but I'm sure that a few years back, let's say before COVID, you must have seen a lot more cases.
It was always worse. Yeah.
Yeah, because the protocols were very different. They were still going for higher doses of drugs. And then you can see those effects a lot more. I mean, even if somebody takes an emergency contraception pill, you can see the effects for the next 2 cycles.
Of course.
So then these are much higher doses of drugs.
Even medication that people take to just delay their periods, that's also going to cause a lot of changes in your skin and hair.
Also, I think people should, if they can, please avoid taking the medication to delay your
Constantly for every
periods.
puja in your house, you don't have to keep, like, it's okay.
That's
Every
a can
goddess
of
also
worms.
probably got her periods, so not a necessity. But yeah, so all of this acne, all of the hair fall, and all of these things that happen during fertility treatments, yes, they can happen. But as a dermat, I feel they're very temporary, they're very treatable. So I don't think you need to worry about that as much when you're planning a pregnancy.
Maybe. I mean, I'm pretty sure that most of that would be reversible if the hormones, when the hormones do stop. So yeah, I think not really a point to be worried about at that point.
Okay, next going on to a rapid fire round.
Okay.
So let's go super quick on these.
I'll try.
What is one myth about fertility that makes you want to scream?
that anybody can have a male child.
What is the ideal age window to freeze eggs?
Anytime you want to.
Absolutely anytime.
Absolutely.
But if I have to choose, I'm 20 and I'm going to plan कि मुझे
Yeah,
शादी
you still
40
have
पे
time
करनी
then.
है.
If someone's 20, then they can wait till 28, 29.
Yeah.
They don't have to get it done at 20.
Okay. What's the worst thing women do for their fertility?
Oh, wow. That's a lot of things. From scented candles to smoking.
Oh, wow.
Yeah.
Scented candles also.
Oh, yeah.
Oh, wow. So endocrine disruptors.
Yes, absolutely.
Oh. What is one habit every woman who, if she wants to plan a pregnancy at some point, should start today?
One habit. Definitely check your vitamin D, B12 levels. If you're not consuming enough protein, consume enough protein because your body will require all the nutrition. And if you like to party and smoke and drink, stop 3 months before you are planning for pregnancy.
Okay. Yeah, that's a good point. Next is what's more important, age or lifestyle, when we're talking about fertility?
The importance of lifestyle will increase with age. So, yeah.
I know.
Yeah.
I can see how I cannot sustain the lifestyle I had in my 20s.
At
Now
a
in
younger
my
age, you can do a
30s.
lot of things.
The next question is coffee. Is it a friend or a foe for fertility?
Friend.
A friend.
Yeah.
Okay.
Everything in limits is a friend.
Correct. And the last question is one message for women who feel they're running out of time.
There is egg freezing available.
Correct.
Explore that option.
Yes. Next is there's a lot of myths about IVF typically, that IVF babies, would they turn out to be the same as naturally conceived babies? Or would you always have twins when you do IVF? What's the deal with that?
So a lot of times we consider IVF pregnancies as high risk pregnancies, even though they are not. It's just because the whole procedure has, it's assisted reproduction. So we categorize them as high risk pregnancies. They are not. But when the baby is born, I guarantee you won't be able to differentiate between a normal baby, a naturally conceived
Why
baby,
would you?
and an IVF baby. So that is absolutely horrible if people think that, ये थोड़ा अलग सा दिखेगा बच्चा या ये तो हम भगवान के अगेंस्ट जा रहे हैं ऐसा भी बोलते हैं. But and why the incidence of twin happens in IVF is because it depends on the number of embryos that are transferred. So in a lot of cases, people will transfer 3 or 2 embryos, hoping that one implants. In some cases, 2 will implant. In some cases, 3 will implant. So in that case, you might have a chance of twins. Very rarely triplets. But yeah, if you just choose to get one embryo transferred, the chance of twinning will not exist or will be absolutely rare.
Okay. Lovely. That's helpful. That was so eye-opening, Prateek. And I think this is going to be so helpful for so many people who are planning a pregnancy or trying to delay a pregnancy. And these are very vital questions that all of us need to know to, take empowered decisions about our lives. So thank you so much. It was really a pleasure having you today.
Thank you so much for having me. It was really fun as well.
If you found today's episode valuable, do share this with someone who needs to hear this, who's going through a journey of planning or delaying a pregnancy. If you have any questions, please ask us in the comments and don't forget to like, share and subscribe and stay tuned for the next episode.